I don't think anyone likes living there. I don't live there. But even if you very stressful. No reason to go unless you're working that.
Restoration! When do we want it? Now! What do we want?
Pay restoration!
When do we want it?
Now!
What do we want?
Pay restoration!
When do we want it?
Now!
What do we want?
Pay restoration!
When do we want it?
Now!
What do we want?
Pay restoration!
How are we gonna get it? Strike! What do we want?
Pay restoration!
How are we gonna get it?
Strike!
What do we want?
Pay restoration!
How are we gonna get it?
Strike!
What do we want?
Pay restoration!
When do we want it?
Now!
What do we want?
Pay restoration!
When do we want it?
Now!
There's a new one. Repeat after me. Moaning minis, that's the line.
For an F1, you are, yeah, no, good on you. And then for someone who just,
So, we're on strike again today. I'm actually really disappointed. I'd rather be at work, and I didn't really think it was going to come to this. We're on strike because the rug has been pulled out from underneath the negotiations at the last minute by the government. We had previously agreed on a package of funding that they were going to provide to help restore our pay back to where it was after over a decade of pay cuts. And at the last minute they've walked into the negotiating room and reduced that package significantly, and then, after reducing it, spread it over 3 years. That's resulted in locking us into that deal would have resulted in locking us into pay cuts for 3 years, and that's obviously not something that's acceptable to our members. It's not acceptable to us, and it just worsens the whole problem that we were in the first place. It's to take industrial action in order to achieve it. In terms of the affordability of what we're asking, look, the NHS budget for next year is going to be, well in excess of £200 billion. The cost of pay restoration for doctors, originally, when we first asked for it many years ago, it was £1 billion. Rachel Reeves described our more recent pay uplift as a drop in the ocean. I think it shows that the government actually know that it is affordable for them and that they have the money, but they'd rather spend it elsewhere, or rather not spend it at all. I think they're more preoccupied in chasing headlines than actually fixing any problems that exist. Well, look, nobody likes strikes, do they? I certainly don't like them. I don't like them as a doctor. I'd rather be at work. I need the money. I have a mortgage and I have a son. You can probably hear him in the background. And as a consumer, I don't like them. When other services are on strike, and I can understand that. And I'm a patient myself. I use the health service. My father has been waiting for 2 years for an operation on his shoulder, and he's been in pain this entire time. And he's unable to get that operation because there aren't enough specialists working who can perform that operation for him. Now, we've been arguing for years that we need an increase of specialist training posts, and now the government at the last minute has chosen to take those away and off the table. All that's going to happen is it's going to make the problem entirely worse, and it's going to reduce the number of specialist doctors that we have in the future for patients in the future. So I think really the public need to realise that we're a canary down the mine here. We've been very, very clear that the government needs to invest in the NHS to make an NHS fit for the future, and they're just not doing it.
But do you feel the public are still behind you?
I think people are behind the idea of restoring people's pay to where it was, and people understand that when your pay has been cut by so much for so long, that you have the right to feel aggrieved. And I think people understand that we would want to have that restored to where we were, because at the end of the day, doctors are not worth less than they were. I'm not worth a fifth less than any doctor in 2008. And I think people understand that.
And what about the support amongst your colleagues? Is it still as solid as it was maybe a couple of years ago for this? Does it seem to be wavering at all?
The government time and time again have tried to claim that the BMA is out of touch with its members, but unfortunately it's just not the case. Unfortunately for them it's not the case. We have repeatedly been polling our members on this, and they are very firmly behind us.
Yeah, so I'm Dr. Sam Taylor-Smith, psychiatrist working in Bristol, and I'm the Regional Resident Doctor Committee Chair.
And can you tell us a bit about what's happening behind you?
Yeah, so unfortunately we're out here on industrial action, strike action once again. The government put forward an offer which was diluted down at the last minute, investment stretched from 1 year over 3, and we felt that wasn't good enough for our members. For some of our members it would have been terms pay cut, so although we recognise there were aspects of the deal that we felt were very positive, it didn't quite go far enough, and the government has not come back with an additional offer, and therefore unfortunately we've been forced to take further industrial action.
And what's the mood like today? How much support have you had from patients coming into the hospital and cars passing?
So I'd say generally people are supportive. Obviously I think we have some people who are understandably frustrated with the longevity of the strikes. We are also frustrated by how long they've gone on. We'd like to see a resolution. What I tend to find is that when members of the public come and speak to us on the picket line, and if you've got any listeners who are coming past today and would like to, I'd be more than happy to have a chat with them, hear their views. But when we explain our position and how we've got here, although we don't necessarily see full throttled support, we tend to see a bit more of an understanding and a bit more of kind of a sympathy with our cause.
And what's the one thing the government could do to get you back into the building today?
I think if they could bring, if they brought forward a credible offer and a credible improved offer, we would be happy to call off the strike action, from today. That's always been the case. Unfortunately, the government often takes a position of not wanting to negotiate during industrial action. Personally, I think that's the wrong approach. I think they should be trying to pull all the stops to try and make it, to try and bring the strike action to a close. You know, I can't necessarily talk specifics, but I think what we do want to see is just slightly more investment in the pay packet and a couple of other areas as well to iron out. I don't think we're a million miles away from a tangible deal, but I think we do need to see those things, as we've highlighted in our letter to West Streeting, before we could consider putting it to members.
And I know you've touched on sort of people that you're talking, and I asked you about how patients and members of the public have been reacting. Do you have a message to patients whose appointments have been cancelled, who've been waiting long periods of time?
You know, first and foremost, I would say sorry, as I do kind of 365 days a year, because we're constantly seeing cancellations due to inadequate levels of staffing. Particularly, we know, where I work psychiatry, we often struggle to recruit substantive consultants, and there just isn't the kind of doctors coming through that training pipeline that there needs to be. So that's been one of our key asks in this dispute, has been about trying to improve that pathway to create a workforce that's fit for the future, so that we don't constantly have to apologise to patients day in, day out for delays and cancellations.
And there are lots of people today, and I know you've touched on this already, that have had so much industrial action. When's it going to end?
Yeah, I mean, I often feel like that as well. I do kind of see a bit more positive movement with this government, but I think we're still not quite there yet. And unfortunately, there's still been at times kind of grandstanding and posturing rather than kind of meaningful engagement. But as I said earlier, if West Streeting was to put forward an offer today, we could call off industrial action now. That's always been clear, and I'm really kind of hopeful that we're going to be able to see an end to this, as you said, long-running dispute.
My last question is that
But like, if it goes to like one person, like they must be flooded. I can't imagine they'll be
my last question to you was going to be about your members. So how are your members feeling? What sort of the feedback you're getting from members?
So I think members, I don't think any doctor takes industrial action lightly. I think that members want to see an end to this dispute. I think that they recognise, particularly when we've spoken to members, they recognise the issues that were in the deal, and I think they're resolute, but they are also keen to see this dispute come to an end. So, I would really say the ball is in the government's court. If they can just bring forward a little bit more of something, then we may be able to get there. And I think that would be good for government, good for doctors, but also good for patients.